We have with us tonight Yukon Premier Sandy Silver, Dr. Brendan Hanley, Chief Medical Officer of Health, and Dr. Catherine Elliott, Deputy Chief Medical Officer of Health. Closed captioning will be available on the live stream on the Yukon Government Facebook site. We will take questions after the presentations.
There's a mic right there.
Can you not hear me? And we do have 4 callers on the line, so we'll take questions from them after we've taken the first round of questions from our local media. Dr. Hanley?
Hi everyone, and thank you for coming out on Sunday evening. Bonjour tout le monde et je vous remercie pour venir. I want to begin by thanking everyone in this room, in public health, in leadership, in our workforce, in our home, and in our communities for what they are doing to limit COVID spread and impact of Yukon. I am very aware of everyone's anxiety that I have heard and seen amongst us. I have received hundreds of emails, calls, and texts in the last few days expressing concern about COVID's inexorable creep towards our territory, messages of fear, but also of hope, helpful suggestions, resolve, gratitude, and love. I do my best to read them all, and much of what I tell you is informed not just from science and the wonderful public health minds that we at the World Health Organization and around the world, and not least what we have in our own country, but also from the sound advice of Yukon leaders and citizens. I have lots of news today, including information about our first cases that we found out about just this afternoon. I think you will be reassured by some of this news, that our system is working, that these individuals did everything correctly and are doing very well. I'm going to just say a little bit of the same in French. And I might say, as I say, excuse my French as I left my French notes to get over here. Mais je remercie tout le monde ici et dans le secteur santé public, notre leader et dans notre endroit de travail, dans nos foyers et dans nos communautés, pour les efforts qu'ils ont faits pour améliorer l'impact du COVID au Yukon. Je suis très conscient de l'anxiété de tout le monde que j'ai entendu, que j'ai vu entre nous. J'ai reçu tellement de messages, des textes du COVID, des messages de peur, mais aussi de l'espoir, de résolve, de gratitude et même de l'amour. Je fais ce que je peux pour l'aider, mais ce que je vais vous dire aujourd'hui, les messages que je vais vous dire, c'est basé pas juste sur la science et sur la santé publique, mais aussi de les citoyens, de nous, de vous, les conseils, les bons conseils des citoyens de Yukon. J'ai beaucoup de nouvelles de vous dire, des nouvelles peut-être dures, des nouvelles sur les premiers cas, qu'on vient d'avoir des résultats juste cet après-midi. Mais entre toutes les nouvelles un peu difficiles, il y a beaucoup qui est rassurant. Que notre système fonctionne, ça marche, et que les individuels concernés ont réagi correctement, ils ont fait toutes les mesures qu'on a toujours conseillées. We are naturally focused on the momentous news of the first cases. But it's important to remember three key things. We were expecting this. These two cases do not change the risk of acquiring COVID in Yukon. And the incremental measures we are putting in place as of this evening are not based on these two cases. They are measures we were already preparing to announce for tomorrow based on the increasing circulation of COVID in this country and the risk that this poses to community circulation of COVID in Yukon. These cases are a couple from Whitehorse who traveled in the United States. They attended a convention, were notified of a case of COVID at the convention. According to advice they received, they carefully self-isolated at home. Due to symptom development, they were both tested. Test results were received within 3 days. They are continuing self-isolation at home. Contact tracing through public health is going on as we speak, and they're both doing well. They're meticulously following public health advice, and they were from the beginning. They were asymptomatic during travel. They phoned, and they got treated as soon as symptoms developed, and they have mild disease. This is exactly what we were predicting as a likely first case in Yukon, and due to the containment and isolation, these cases do not change the risk to us, the public in Yukon. This case, therefore, illustrates the benefits of careful public health practice. Good communication of risk, compliance with advice and direction from public health officials, and prompt detection of disease. Donc, quelques mots sur le cas. Les deux résidents les deux cas ont été confirmés ce journée-là, dimanche matin. Les deux résidents de Whitehorse sont de même âge et ils sont revenus des États-Unis la semaine dernière et se sont isolés. Lorsque les symptômes se sont manifestés, ils ont communiqué avec le contrôle de maladie, ou ICDC, pour avoir un test. Ils ont une maladie qui est bénigne, qui n'est pas grave. Ils continuent de s'isoler à la maison. Je veux dire que ces deux cas, que rien n'a changé depuis les nouvelles de ces deux cas aux mesures de la risque pour les Yukonais. Les premiers cas démontrent que les systèmes qu'on a mis en place pour diminuer la propagation de COVID fonctionnent. Et les individus ont suivi les conseils des officiels de santé publique. La coopération avec toutes les mesures de santé publique est essentielle à la réponse à COVID-19. Before I proceed to announcing our measures, I want to reiterate that these are measures that we're compelled to put in place due to the national situation and due to our continued need to base our strategy on risk to Yukon, and especially to Yukon communities, that is driven by the course of the epidemic south of our territories, and that nothing about these first cases has influenced or changed our decisions. I also want to remind Yukoners of our general goals and our strategy. Our goal, delay COVID, flatten the curve, and limit its spread, while doing our best to keep society running and to maintain our well-being. Our strategy, aggressive testing, aggressive social measures, including adhering to social spacing and social isolation and self-isolation when required, and protecting our most vulnerable citizens and communities. I want to also emphasize that we have high rates of testing, and in fact, our testing rates are higher than any other jurisdiction in the country. I also want to say that due to different patterns of COVID increasing in different parts of the country, the timing and the approach to the measures we are taking is not going to be at once. It's not going to be synchronous, and not necessarily the same measures in place for each part of the country. But we all share the same goals: delay and reduce the impact of the COVID epidemic and protect, again, our most vulnerable citizens and communities. We hope, because of the faster turnaround on COVID-19 test results, to have cleared the backlog in the next few days. And by early this week, we will be publishing how many tests have been completed on the yukon.ca coronavirus website 3 times a week. Now, some of the measures. The first is about non-essential travel outside of the territory and also travel within Yukon. I am now strongly advising the suspension of all non-essential travel into and out of Yukon. In addition, I'm asking Yukoners planning to return home in the next 30 days to return as soon as possible. And in view of our need to protect remote areas, more remote communities with limited healthcare resources, I am strongly advising the suspension of any non-essential travel to Yukon's rural communities. I'm going to try to say the same thing in French. Premièrement, pour les déplacements et des déplacements à l'extérieur du territoire et dans la région rurale du Yukon. Afin de limiter la propagation de COVID-19 et de protéger les citoyens les plus vulnérables du Yukon, je recommande fortement de suspendre tous les déplacements non essentiels, tous les voyages non essentiels avec les destinations et en provenance du Yukon. Tous les Yukonais qui prévoient rentrer chez eux au cours des 30 prochains jours sont invités à revenir le plus tôt possible. Et compte tenu de la nécessité de protéger les régions plus éloignées, les communautés plus éloignées, avec des ressources médicales limitées, je recommande fortement de suspendre tout voyage non essentiel dans les communautés rurales du Yukon. Self-isolation for travelers, all Yukoners, not just international, but all Yukoners returning home and all visitors to the territory from outside Yukon are now required to self-isolate for 14 days. This includes anyone returning home from other provinces and territories by road or by air, as well as Yukoners returning home by road from Alaska. And we are putting mechanisms in place to monitor and ensure travelers are self-isolating. If you cannot self-isolate at home, there is an email, as included on the release, for information and advice. All Yukoners who return home and have respiratory symptoms, that means cough, fever, or difficulty breathing, are asked to call 811 to get advice on COVID testing. Tous les Yukonais qui rentrent chez eux et tous les visiteurs du territoire doivent s'isoler pendant 14 jours. Cela comprend toute personne rentrant d'autres provinces et territoires, si c'est par la route ou par avion, ainsi que les Yukonais rentrés chez eux par la route de l'Alaska. Et nous sommes en place des mécanismes pour surveiller et de renforcer l'auto-isolation des voyageurs. Il y a des moyens à vous appuyer si c'est difficile de suivre les mesures d'auto-isolation. Il y a un courriel pour obtenir plus d'informations et des conseils. En plus de ça, tous les Yukonnais qui rentrent chez eux et présentent des symptômes respiratoires, ça veut dire toux, fièvre, difficulté à respirer, sont priés d'appeler le 811 pour obtenir des conseils pour le test de COVID-19. Restaurants and bars. Restaurants must immediately reduce their seating capacity to 50% and have the means to space people 2 meters apart, and prepare over the next few days to offer takeout and delivery service only as of opening on March 26th. As of closing time tonight, March 22nd, Sunday night, all bars must close until further notice. All personal establishments must close by the end of the day, Wednesday, March 25th. This includes hair salons, barbershops, tattoo parlors, nail salons, and massage therapists. Les restaurants doivent immédiatement réduire leur capacité d'accueil à 50%, avoir les moyens d'espacer les personnes de 2 mètres et se préparer à offrir des services de livraison et des plats à emporter uniquement à compter de l'ouverture le jour de 26 mars. À compter de cette fermeture ce soir 22 mars, tous les bars doivent fermer. La prochaine année, indéfinitivement. Tous les établissements de services personnels doivent aussi fermer d'ici la fin de la journée, le mercredi 25 mars. Cela comprend les salons de coiffure, les salons de tatouage, les salons de manucure et le massage. For gatherings of more than 10 people are now banned. These are social gatherings, and smaller gatherings should ensure spacing of 2 meters between people. And you should not attend any social gatherings, even less than 10 people, if you have any respiratory symptoms. Again, cough, fever, difficulty breathing. If you're over 65 or you have an underlying health condition, or if you work in healthcare, a healthcare facility, or in other essential services. Les rassemblements de plus de 10 personnes sont interdits. Les petits rassemblements devraient assurer un espacement de 2 mètres entre les personnes. Les Yukonnais ne devraient assister à aucun rassemblement social, même ceux de moins de 10 personnes. Si vous présentez des symptômes pseudo-grippaux, ça veut dire des symptômes respiratoires. Si vous avez comme âge plus de 65 ans, ou si vous avez une condition médicale chronique, ou si vous travaillez dans les soins de santé, dans un établissement de santé, ou dans des secteurs des autres services essentiels. That is the package of measures for today. I know that these are probably not surprising. These are anticipated. And that we recognize, once again, the sacrifice that that entails for Yukoners. I know there are those who might say, we're going too far. There are others who might say, this is not far enough. And as always, we try to balance our measures against the risk and be prepared to augment our measures according to our measurement of the risk. C'est un moment très difficile pour Yukon et je reconnais les sacrifices qu'on a déjà faits et les sacrifices en demande des Yukonais. Je vous demande d'avoir la patience et le support et d'être prêt pour avoir des mesures même plus fortes selon le risque qu'on mesure dans les prochains jours ou semaines. We have, at the last news conference, declared this a public health emergency, even before our first cases arrived. Having declared the state that I shouldn't say state, I should say the public health emergency, because that is different from a state of emergency. But having declared the public health emergency, that does give us the means to enforce. I know there will be questions about how well can we enforce, for instance, measures of isolation. It is important first, though, due to the continued threat and the increasing threat of COVID for our territory, to lay down the law, to lay down the decrees, even before all the mechanisms to put in place the operative measures, the enforcement measures are in place, such as the speed of this epidemic and such as the need to react. I want to thank you all again for the support. I also wish to support, to recognize and support, or to recognize the support that we have received and that the important role that you in media play to help us get the messages out and to ask the questions that need to be asked so that everyone can understand the importance and the need to comply. Je veux remercier tout le monde et tout le monde dans le média pour nous appuyer et pour nous aider à propager les messages importants et le besoin de comprendre pas juste les mesures, mais les raisons derrière les mesures. I thank you, and before questions, I will allow Premier Silver to speak. Thank you.
Thank you very much, Dr. Hanley. Today's announcement of 2 confirmed cases of COVID-19 is troubling, but not unexpected. What it means is that we must reiterate to Yukon the seriousness of this situation and the actions that we can and must take to reduce the spread. Our government, our Minister of Health, Pauline Frost, and the medical community have been preparing for this day and what we believe will come in the next days and weeks as well. The medical and emergency management system is working incredibly hard to support Yukoners, and I am confident in the people who are doing this great work. Now it is on us, each and every one of us as Yukoners, to take this situation even more seriously. Yukoners are being instructed to self-isolate when returning from elsewhere, anywhere outside of the territory. This includes coming back from other places in Canada or international travel destinations. Travel restrictions will mean that no recreational visitors will be able to travel to Yukon. People will not be able to come as tourists or to visit friends or family for non-essential purposes. The borders will remain open to Yukoners who are returning home. If you are a student coming back from school or a Yukoner away for personal travel, now is the time to come home. When you come home, you will need to self-isolate for 14 days. If you do not have the ability to do so safely, please contact us through yukon.ca and we will help. If you are providing an essential service, you will need to follow the self-isolation guidelines and practice social distancing. If you are not well, or if you have any symptoms at all, stay home. Use the self-assessment tool that is available on yukon.ca and monitor your symptoms. If you need medical help, call 811 or 911 depending upon the urgency. I want to thank Yukoners who are taking these important steps and taking this seriously. The 2 people who did test positive, they followed the guidelines exactly, and I want to thank them for doing so. By following the guidelines of self-isolation, they reduced the spread of the virus. Please, Yukoners, follow these instructions. Dr. Hanley has very clearly laid out what we can do to protect ourselves. We must do it all together. Let me be clear, there is no medical treatment for the virus. The only certain treatment currently is through prevention. We must all work together to reduce the spread and to protect fellow Yukoners. Get the most up-to-date information at yukon.ca. We know that this is rapidly changing and at times may seem overwhelming. Please rely on information that is trustworthy. Get up-to-date at yukon.ca, listen to Dr. Hanley, and listen to the trusted news outlets. It is not the time to spread misinformation. We know that these are difficult times. If you are a small business owner or an entrepreneur, you may be worried about your business. Help is coming. We anticipate having more information on our supports efforts very soon. We are working closely with our federal government and will combine efforts to support as many Yukoners as possible. We are working rapidly on regulations to prevent evictions related to COVID-19. If you are worried about your home, we are working to help give you certainty. Yukoners, it is your responsibility to stop the spread of this virus. Please stay home if you're not well. Wash your hands. Do it again. You cannot wash your hands too many times right now. Shop locally and shop responsibly. Grocery stores are being restocked. You do not need to hoard. Practice social distancing. I know it's incredibly hard because we love to gather and we can't right now. You need to keep your distance from people. You need to stay home. Be with your immediate family and your housemates. If you are going outside to enjoy our amazing wilderness, please do so responsibly. We knew that COVID-19 would make its way here. Now we must do everything we can to reduce the spread and to support one another. I do want to take a moment to thank all of the incredible hard work from the members of Yukon's health community. Minister Frost, our Minister of Health, and her entire team of dedicated public servants are working extremely hard right now for you. To our medical community, each one of you is working so very hard right now, and I want to thank you all for all that you're doing to keep our territory safe. To Yukoners, stay home if you're not well. Again, I can't say that enough today. Self-isolate if you're coming in from outside the territory. Wash your hands and monitor yourself and your family for symptoms. Again, go to yukon.ca and get the information you need to stay up to date on any changes. Changes are happening rapidly. But most of all, and this is extremely important, be kind to one another. Call your family, call your friends, check in on them and make sure that they're doing okay. If you need help, reach out. We have supports in place for people who are struggling through these times. I don't need to remind anybody here, but Yukoners are strong people. We will get through this by supporting each other and by working together. Thank you very much. If there's any questions, we'll take them at this time.
I could just ask you to come up to the mic, please, if you have a question. You should be able to shout to 2 years away.
Hi, I have a question. I have a question about self-isolating after domestic travel. I'm wondering if you returned from domestic travel, say in the last week, should you start self-isolating tomorrow if you've been out since then?
It's a really good question, and there's always a difficulty in maybe how do we manage when we make a measure one day that wasn't there the day before, because of course the risk to Yukoners is an incremental risk, but at a certain point we have to make major changes in what we, in the measures that we impose, even though the change in risk from one day to another actually is very little. So I would say it is good practice to self-isolate for those who have returned in the last few days, but it is not something that we would enforce. I think that the moment the writ drops is when the mechanisms for enforcement, should we mobilize them, would come into place. But we are requesting all to do their part within the means that they have.
In regards to banning gatherings, how do you define a ban? Like if somebody were to gather more than 10 people together, how do you enforce that? Are there going to be fines of any sort? Yeah.
So again, this is where we are putting a ban in place, just like we put a ban in place on the 50, on mass gatherings of 50 or more, was it a week ago or 10 days ago, we are asking the cooperation of Yukoners at this point, and then we're looking at enforcement mechanisms to come into play over the next few days.
Which could entail what? A fine? Like...
So right now, the federal government is convening on Tuesday, and they are having meetings and gatherings about exactly this, emergency measures. So I assume we'll be seeing more on that from the federal government this week. And as we are waiting for that information, we're also working through our departments to see what mechanisms we can get in place right now. It was really important to have the medical medical emergency first and foremost, and we are relying on Yukoners currently to make sure that we do best practices. And so far, this has been very successful. If any other measures come down as far as enforcement or fines, we will let you know as soon as those happen.
Thank you for the question. I think the question about enforcement is an important one because we do have mechanisms to enforce if we need to. But I really want to get real here. If you're closer than 2 meters from somebody, you're at risk of spreading a disease where the only mechanism we have to stop the spread is prevention. So I think every one of us have to think about that and think about taking these measures very seriously in order to protect the health of everyone in our community.
But when you say there are measures, like is there anything like literally in place right now that you can use to, like anything like a fine of some sort, any specific thing?
The authorities are there under the Public Health and Safety Act, yes. So, but the actual, how that's going to work, how it will be monitored, whether it will be a fine or something else, how much the fine will be, all of those things have to be worked out.
Tim Kacharik, CKRW. The 2 people who tested positive, did they fly in? Did they drive back? If they flew in, have you identified which flight and notified the people around who sat around them? Can you maybe go into those details, if possible?
Thank you for the question. 2 individuals who tested positive today flew into Yukon. When they flew in, they did not have symptoms. We are not contact tracing when people do not have symptoms at this time. That's the practice in Canada and in many parts of the world. We will not be publishing the flight or any of those pieces because we do not contact trace people who do not have symptoms. There have been a number of people who have traveled symptomatic in other parts of the world, and contact tracing has occurred when people have traveled symptomatic. In general, the number of contacts who are affected are extremely small, even with symptomatic travelers. We are actively talking to all close contacts and testing those where they become symptomatic and testing is necessary. At this time, we continue to ask all symptomatic people to please stay home. Thank you.
But, sorry, just to follow up, but even those who don't show symptoms could carry. That's from my understanding. Can you confirm that? And then why wouldn't you go around? I know that's the policy for Canada, but why wouldn't you go around and notify the people to either self-isolate or get tested if they were seated immediately around them on the flight?
Yeah, it's a good question, and the question of asymptomatic transmission comes up repeatedly, and it appears it does exist, but that its role in the epidemic is probably very small. We also had to again apply risk management. If you have to go where the risk is in terms of your public health resources. So asymptomatic infection on planes or spread on planes has not been documented. And as Dr. Elliott just said, even where symptoms are present, airline travel is done. Airline travel contact tracing within a few rows for symptomatic people is the practice, but in fact has yielded few, if any, secondary cases. So again, the use of public health resources is focused on contact tracing, on notifying, identifying symptoms, and testing symptomatic people. And that, combined with the social measures, is the medicine.
Jack, and then we'll go to the phone.
I was wondering if you could elaborate on the difference between self-isolating and social distancing as well. Premier, you mentioned, like in the Yukon, a lot of people are, for example, going outside, going to the top of a mountain and saying, I'm self-isolating. Does that count, or should Yukoners be just 100% in their homes?
Yeah, it's a good question and a very important question. And maybe I'll start with the last part. And as the premier said, going outside is good practice. Going outside in groups is no longer something that we recommend. But certainly as an activity, as part of social isolation, then yes, we want Yukoners to continue in these more limited ways to enjoy the outdoors, to make sure that they get their exercise. I think I read something today about go outside for exercise, go outside for activity, go out on the land for hunting and trapping, but observe the principles of spacing as you go outside. And so don't go outside for socially, but go outside for being on the land, for connecting to the land and being active. That is the principle. Social isolation, the social isolation principles are otherwise staying at home or staying in an environment where you have a bathroom to yourself and you don't share that space less than 2 meters. It looks like you have a follow-up question.
Yeah, sorry. For example, if somebody does have symptoms, are they allowed to get into their cars, drive out into the land where there's no one around them, or should they remain in their homes?
Okay, if someone has symptoms, okay, now what we're asking for someone that has symptoms is then to match that with COVID assessment for one thing. Do they have symptoms associated with travel? Then they need to have that assessment for testing. If they don't meet those criteria and they're well, then our advice is to stay at home, and the reason that we ask them to stay at home is to avoid contact with others. If someone has symptoms, they're well enough to stay at home. To stay at home, they don't need to be seen by someone medically, and they want to go outside without while observing social spacing, then that would also be that also is acceptable. Yes.
Should we go to the phone line?
Okay, we're now going to, we at Talman Commit, we'll start with Nicole with Canadian Press by order of calling. Nicole, and then we'll follow Nicole with Claudine avec Radio-Canada et Marin Humain avec Aurore Auréal Plessa sur
I said at the beginning. So that the question was, is this now the time to panic? And of course, there is never a time to panic. This is a time to be together in isolation. So this is when the solidarity is important. And as I said at the beginning, I recognize the anxiety, even fear, but this is containable. We can do this. We can do this by enduring the hardships that are ahead of us. Safe social spacing, physical separation but social togetherness, safe spacing as a normal practice. Self-isolation for those at risk, such as returning travelers. And active public health that includes aggressive testing, identification of cases, contact tracing, and investigation. So it's that combination that we will overcome, we will flatten that curve, and we can do this, but we can only do this by observing all of those things and by being in solidarity with each other.
Okay, thank you, Nicole. Et on va continuer avec Claudien. Claudien, s'il vous plaît. C'est à vous, madame. Claudien, Radio-Canada, êtes-vous là? Okay, Melanie? Oh yes, I can hear you now.
Okay, great. I'm just kind of wondering what other steps are left to be taken if need be, or have we reached all of the protective measures at this point?
I think the question was what's next? What are we anticipating? And it's a really good question. We're already thinking about next steps. There are intensive conversations with our colleagues across the country, both in the political sphere and in the public health sphere. Close examination of what we know about the epidemic and what are the other ways. So broadly, anything is on the table, and we have to look at ideally measures that we put in place that are coordinated as best as possible. So I can frankly tell you that I don't know what I'm going to be saying in 3 or 4 days. I think what the most important thing is to put in place the operations element of what we are saying today to allow the measures to actually take place and begin to have their effects, and to make sure that the supports are needed to help people observe these new restrictions. So that is the focus, and at the same time, we are examining the epidemiology, conversing with our colleagues, and anticipating the possibility of further measures. That's about as specific as I can be at the moment.
I'll add to that, Claudiane, that we're in a lucky place right now in Yukon in that we're one of the last jurisdictions to have cases. And we can watch other jurisdictions and see next steps from other jurisdictions. Now, with that being said, I'll echo Dr. Hanley's comments. Not every jurisdiction is the same, but we can see on the horizon what other jurisdictions are doing. And our next steps are going to be based upon how diligent we are with current steps. Because we are experiencing our case now where there's already travel restrictions, where there's already border restrictions, these types of things, where we have a well-informed public that knows what the current steps. All of these measures are going to help us to reduce our curve. So that's the most extremely important piece right now is, our next steps will only be determined by our diligence with the current steps. So again, it's on us as Yukoners to practice the social distancing, to be aware based upon going to yukon.ca. There's tools there that will answer a lot of the questions as to what you should do if you've been traveling, or how to self-isolate, what the difference is between that and quarantine. So all that information is there, and it's up to us to adhere to those strict guidelines before we go to next steps.
OK. And la prochaine, c'est à vous, Marin. Marin, êtes-vous là? Aurore boréale?
Oui, je suis là.
OK.
Oui, c'est moi, vous m'entendez?
Oui, s'il vous plaît, vous pouvez continuer en français? Oui.
Alors, ma question, c'est, est-ce que je pourrais parler en français?
Oui, oui.
Ma question, c'est, les rassemblements de 10 personnes sont bannis. Qu'en est-il pour la garderie?
I think this was a question about daycares. Je crois que c'était une question pour les garderies. Et rien. Hein? Oui, ok. Selon nos recommandations, rien n'a changé depuis les dernières annonces que on va continuer de permettre l'ouverture des garderies. C'est pour continuer le soin qui les enfants ont besoin, mais avec les observations des espaces sociaux. On a des garderies qui ont déjà fermé selon leur décision. Mais il y a beaucoup où les parents ont retiré. Donc il y a moins des enfants dans les garderies à ce moment. Les services de garderie, c'est un service essentiel pour continuer la société et pour permettre les parents ou les gardiens de continuer à contribuer de la société, de travailler dans les services essentiels. Donc c'est toujours une balance. À ce moment, on n'a rien changé. I think I'll just repeat that question in English. And that was about the daycares and child care centers and whether we were changing our recommendations. And we are not at this point. We are continuing to closely follow it and closely be prepared to change our advice, but based on the current risk versus the need for daycares as an essential service, we are allowing them to continue. They provide an essential service to allow parents and guardians to be able to work, to be able to continue contributing in the essential services that are required to keep society running. There are also children who are more vulnerable, where there may not be other choices, where their needs are best met in the daycare setting. And I can't remember the last part I was going to say, but that's the essential part of it. Thank you.
Thank you very much. We'll wrap it up now. Thanks
No
for
other,
coming.
no other questions?
No more questions.
Why? Like, it's such a huge, like,
Well,
this is okay.
We're going to wrap it up.
Like, people are going to keep
Thanks.
talking. I really think we should keep asking questions.
Thank you very much.
Are you two up for answering more questions?